welcome back to another video. In today's video, I'm going to talk about my experiences in helping patients with the coronavirus or COVID-19 and some of the changes I've seen in the hospital. So let's get started. Alright, so before I begin, I have a few announcements. I want to thank everybody for subscribing down below. I really appreciate it. I've recently hit 1,000 subscribers like I mentioned in my previous video. And to thank you all, I'm going to be giving away 3 Amazon gift cards. So be sure to watch the end of this video where I talk about what you need to do to enter the giveaway. So let's get right into the topic of this video. Let's talk about the coronavirus and my experiences first at the hospital. So before I begin, I just want to say one thing. I'm not going to talk about what the coronavirus is, how you can protect yourself, because there's information that's changing each and every single day in regards to how you protect yourself in the healthcare setting, what is the best way to prevent this from spreading, and I just think there are better resources that you can read than for me to explain to you. So check the description box. I'll link 2 links, both of them that are evidence-based, and I think you guys would greatly benefit if you're looking to gain more information. I'm more so here to speak about my experiences in the hospital and my experiences in helping patients. Now, the coronavirus is just like any other virus that we have. There's a lot of viruses that are out there, but what makes this more deadly is the fact that it's so transmittable, like it's so infectious. A lot of people have gotten the virus, and I think they've estimated that approximately 70 to 80% of the population are going to actually contract this virus. Now, what I want people to know is this virus doesn't affect everyone the same way. Generally speaking, if you're a healthy adult, you're not going to suffer severe symptoms of this virus. And I feel like the media has created this kind of disconnect where people think that if they get the virus, they're going to have extreme symptoms on one end and they're not going to be able to recover, or it's going to be very bad for them. No, it's more so that people that are immunocompromised, the elderly people, these are the people that are going to be affected by this the most. So the precaution the government has taken is to protect those people. So in order to protect these immunocompromised, or generally speaking, the elderly people, the government has emphasized that you should self-quarantine if you're not feeling well. You should try and do social distancing. They've also tried to close down many major schools and areas where they think a lot of people come in contact with each other. But let's not forget, if 80% of the people are going to get this, right? Why is the government trying so hard to prevent people from getting it? Well, they don't want an influx of patients like you see in Italy or what you see in Japan. They don't want that influx of patients coming in to the hospital and requiring treatment, and then all of a sudden the healthcare system is overburdened with all these types of patients and they can't provide them the care that they need. So the best way to prevent this from happening is to, prevent the spread of the disease through different strategies like I mentioned. However, despite these strategies that the government has tried to emphasize, there's definitely changes that I've noticed the hospital make because they do anticipate the influx of patients. Because, despite giving all this advice and emphasizing this is what you shouldn't do, there's still going to be tons of people that contract this illness. And in order for them to be treated and seen, they need to have a special area designated for them so that other people that don't have that illness don't contract it, because it's so infectious and because it's so easily transmitted. They want to kind of quarantine them into a separate area of the hospital. So, for example, on my floor, there's a section that's specifically for those patients. And they've closed down certain areas of the hospital. They've rescheduled non-urgent surgeries that are not in dire need. So they've done a lot of different small strategies in order to provide more space for these patients and provide as much equipment as possible, as they expect a lot of the cases of coronavirus to increase. So now I'll talk about how I've treated a patient with COVID and what are the symptoms and signs I've seen in those patients. Now, keep in mind that this is a virus, so you're gonna see typical symptoms of a virus, which is, they have a fever, they have a cough, sometimes they're confused, and generally speaking, the treatment for that is the same. They try and, provide symptom management and what they call supportive care. So if they need oxygen, we provide them with oxygen through nasal prongs, through face masks, through ventilators or whatever, not ventilators, sorry, through high flow oxygenation. And then if they still can't breathe, of course we go into like ventilators, and then they go to ICU and all that stuff. But for the most part, what I've seen is that it's just, I would say it's very typical of some sort of pneumonia, but they don't give, they haven't prescribed antibiotics for it. They treat it symptoms wise, they treat it by giving them like acetaminophen, controlling their confusion by, making sure that they have certain medications to calm them down, making sure that, they get the oxygenation that they need, and making sure they get the nutrition through I sometimes have to feed them. Sometimes I have to reorient them to their place and time and all that stuff. So it just requires a lot of supportive care, which they mentioned in the articles I linked down below. What's concerning about this virus is the impacts it will have to society. So if you think about it, if all the schools turn to online, it's gonna help a lot, but there's still a lot of areas where people can come into contact with this virus. For example, if, I go to work, let's say I had children, I go to work and I somehow get this, and the incubation period is 14 days, so I'm not symptomatic, and then I give it to my child goes to school, gives it to all the children at school, and then they come back home after school to their parents, and then their parents get it, and their parents don't know that they have it, then they give it to their workplaces, then it just continues and spirals like this. So it's a very difficult task for us to contain this virus, and the impacts it has is going to be very interesting to see. So for example, a lot of medications and medicines that we use to treat patients, that's mostly from, countries like China and India, and those countries, when they're affected by this virus, there's a lot of people that don't work in the factories that produce these medications. So we're gonna see a shortage of these medications that are so crucial. And then when you see a shortage of these medications, not everybody is gonna get the medications that they need to, let's say they have some sort of comorbidity, they might have some heart issue and they need some regular furosemide. And that furosemide, for instance, is no longer available. And so because of the shortage, and so that person is going to get admitted to the hospital because they haven't been able to take medication because there's a shortage. So then all of a sudden you get an influx of patients with comorbidities that require medication, and then you also have the COVID patients that come into the hospital, and then it just becomes even more of a difficult task for the hospital to manage. So that's definitely an interesting point, and something that will be interesting to see as the days go by. Another interesting factor is that because nurses, especially on my floor or different floors, come into first contact with this virus, if they start getting ill, then there will be a shortage of healthcare professionals, shortage of nurses, and they won't be able to provide treatment and care for patients that require it, right? If they need to self-quarantine themselves, who's going to treat all these patients? So then it becomes an issue of, do we have enough people to help and treat all the patients that we're going to see? That's why it's so important for nurses that are watching this, or nurses like myself who take care of these patients, to take the proper precautions as listed by the CDC, which is a glove, face mask, eye goggles, and a gown, and utilize strict hand hygiene before and after every patient encounter so that we don't get sick, because our job is so important at this specific time, and it's so important that every one of us steps up to the plate and provides the best care that they can and makes sure that they themselves are safe so that they're able to help other people. Anyways, guys, I hope you enjoyed this video. So like I mentioned in the giveaway that I'm going to be doing, all you have to do to enter the giveaway is give this video a thumbs up and make sure you leave a comment down below, any comment, because that's how I'm going to be choosing the winners. You just have to leave a comment and let me know what your thoughts are on this. Maybe you want to say something interesting, something that you've experienced, anything will do. And all you have to do is, like I said, just comment down below. And that's going to be it for this video. I hope you enjoyed it, and we'll catch you in the next one. Thank you so much for watching this video. I hope I taught you something. I hope you enjoyed it. And if I did, please consider giving this video a thumbs up. Please make sure to also check down below the description box. I do have various links that you might want to check out. For example, I have a free fitness guide, I have a free nutrition guide, and I wrote a free ebook where you can download where I talk about the NCLEX and how I passed the NCLEX and a specific 45-day plan that you can utilize so that hopefully you pass the NCLEX as well. All of this is free. You can check it out in the description box below. And thank you so much for watching, and we'll catch you in the next video, guys.